Everybody for their patience yesterday. I can appreciate what a shock and what a frustrating set of circumstances it was for many in the community. And I'm deeply grateful that the feedback we have had to date has been constructive. People want to support us in getting through this lockdown as soon as we can to allow individuals, families and businesses to bounce back. We know this Delta strain is so difficult to deal with. It's like nothing we've dealt with before in New South Wales. And I just really want to deeply thank all sections of the community who are working hard together with us to make sure we beat this thing. And we're throwing everything at it, all of our resources, all of the restrictions that we think are appropriate for where they're required. And I just want to thank everybody for working together to achieve that aim. Yesterday, pleasingly, we had again nearly 7,000 tests. It demonstrates that even on weekends and during those times of the week when those testing rates haven't been that high, that people are coming forward. Unfortunately, we still had 105 cases of community transmission, and 27 of those cases were infectious in the community, so they were still active in the community, and that's the number that worries us the most. We've seen that number crop up day in and day out, and as we've explained previously, we won't see the effects of these harsher restrictions until at least 5 or 6 days, because there's a lag in the data. So we don't expect to see that number shift massively for the next few days, but we still want the community to be more vigilant than ever before, because I'm convinced that working together we will start to see those numbers nudge, and we are throwing all of our resources and all of our efforts to making that happen. And I just want to thank the community for their cooperation. Yesterday, as we were going through all the health orders, as we're going through all the exemptions, the information is now available on the New South Wales Service New South Wales website. So if anybody has any questions or any concerns, please go through Service New South Wales to have those concerns addressed, or any questions that you might have. In relation to what we call surveillance testing, obviously everybody who works in the Fairfield LGA who needs to work outside of the Fairfield local government area has to go through that surveillance testing, no matter what kind of job they're doing. However, in relation to Canterbury, Bankstown and Liverpool Council areas, in the first instance, we want that surveillance testing to apply to anybody who works in health and aged care. And you have until at least Wednesday before you get your first test. We don't want you to feel everybody's got to go on Monday morning. We want to avoid congestion. Obviously, we want to avoid people waiting for a long time to get that surveillance testing. So if you live in Canterbury, Bankstown Council areas, or you live in the Liverpool Council area, we have asked you to get tested every 3 days if you're going out of your area for testing, but we want that to apply to healthcare and aged care workers in the first instance. All those other authorised workers who work in logistics and transport are also being offered that sometimes in their workplace. But as far as the testing clinics are going, if you work in health or aged care in Canterbury, Bankstown or in Liverpool Council, by Wednesday, please get your first test. It can be on your way to work, it can be at or near your workplace, but please make sure you take that opportunity and don't feel it's got to happen in the hours before you're going to work. Also, can I say that I want to thank the Treasurer, the Deputy Premier and all of our ministerial colleagues who've been in touch with various sectors, business community leaders. In relation to construction, please know that you have time to make your site safe. You have time to make sure you secure those sites and that you have a presence on those sites during the duration of the next 2 weeks to make sure those sites are safe and secure. We understand the need for that, and I just want to thank everybody in the business community who has been so constructive in their feedback, notwithstanding the very difficult times they're going through. I also wanted to stress that if you're having a home urgent repair done to your home or an urgent renovation or replacement, please know you won't get in trouble if you're securing the safety and well-being of your family. If there's something you need to secure the safety and well-being of your family, please don't stress. You will be able to have that fixed. Whether it's a kitchen area or whether it's obviously electricity or water, we want people to know they're safe and secure in their homes, and those urgent requirements will happen. But obviously, if something isn't urgent, if something doesn't have to happen in the next 2 weeks, in addition to the health orders, we do ask everybody to apply common sense. Please know that if you need something to maintain the health and safety and well-being of your community, that will be of your family, that can be taken care of. Again, we know these are very difficult times, but we also know that when we all come together, we can achieve what we need to achieve. We are throwing everything at this. We want to come out of this lockdown as soon as possible. We want to make sure that we allow families and businesses in particular to bounce back as soon as we can, and that's why we're throwing everything at it in the next 2 weeks. Dr. Chant now will give an update, and then obviously Deputy Commissioner Warboys will give an update, and also the Deputy Premier and the Treasurer will give an update in relation to issues the government's been focusing on. Thank you.
Thank you, Premier. So we had 105 locally acquired cases of COVID in the 24 hours to 8 p.m. last night. And of those cases, 69 were in isolation throughout their infectious period, 7 were in isolation for part. But as the Premier said, we've still stubbornly got that 27 cases were infectious in the community. Whilst the majority of those cases are still occurring in southwestern Sydney, with 76 from southwestern Sydney, most of these are occurring 69 from the Fairfield local government area. But can I just stress this? We are seeing cases from across metropolitan Sydney. We are seeing unlinked cases. So every time you leave your house, it is critical that you assume you are coming into contact with COVID. So can I ask everyone to reflect on their movements over the next fortnight and make sure that you do not come in contact with anyone outside your household group. Now, obviously, you're going to have to do those essential things like shopping. I want you to limit that shopping, do it as infrequently as you can, shop purposefully, have a list before you're going in there, wear a mask and put the mask on well before you're going in there. So if you're ever, you're now required to wear masks in shopping, outdoor shopping malls, outdoor markets, outdoor places. So basically any time where you're likely to come into any contact with someone outside your household group, you need to be wearing a mask indoor and out. It is an important reminder that we can transmit COVID and we want to prevent that occurring. In terms of the areas of concern for testing, again, this highlights the fact that the disease is not just in southwestern Sydney, and it is important that no one is complacent. So the areas of concern for testing are Fairfield, Bankstown, Liverpool, Lakemba, Georges River, Bayside, Sutherland, Western Sydney generally. I really want to see a big rise in testing in Western Sydney, particularly in Cumberland, Mount Druitt and Rooty Hill. Wollongong, we've had a sewage detection in Wollongong and there hasn't been a known case there. That could explain that. And also just to let you know that a truck driver delivered pet food on the 13th, 14th, 15th and 16th to a depot in Parkes and Blaney, a pet food factory in Blaney. We're just confirming the details. They'll be released in an alert, but we are just alerting the community to that. And that highlights the importance of the surveillance testing because some of these results that we've had is picking up that early. It also reminds businesses that when you're going about your actions, make sure that you're doing deliveries in a contactless way. Again, every actions that we can take to reduce the interaction between individuals decreases any risk for COVID transmission. Can I also dispel another myth that COVID is a mild disease? I think I've been saying this repeatedly, but I think we can't overemphasise that COVID can lead to illness and death, and it can cause deaths in young people. And you can pass on the infection when you don't have symptoms. So just because you are well doesn't mean you can't infect someone else. These are really important messages which guide the fact that that's why we're asking households to stay together at this time. So there are currently 76 COVID cases admitted to hospital, with 18 people in intensive care, 7 of whom require ventilation. Can I also just acknowledge that Eid starts on Tuesday, the 20th of July, and I know that this is a very special time for many in our community. I just want to reiterate that we're asking that prayers be only performed in your house. And please, again, do not have visitors to your home, including family members, and do not visit others. I'm sure there'll be a range of technology deployed, to allow you to celebrate this most important time, but we do ask for you to ensure that you do comply with the requirements to keep us, your loved ones, and us safe. Thank you.
Thank you, Dr. Chant, Premier, Deputy Premier, Treasurer. Good morning, everyone. 240 infringement notices issued in the last 24 hours right across the state. 43 police areas and police districts involved in those infringements. Of note, more than a dozen issued at Newcastle and a similar amount in the centre of Sydney. What it highlights is the fact that police right across this state continue to respond to Crime Stopper reports and continue to be highly visible in those areas where they think people are stepping outside the public health orders and where they will issue the infringement notices to try and correct that behaviour. What I'd also highlight this morning is that people are well aware of 3 removalists that travelled from down in the Illawarra up to Molong in the Central West. Those 3 gentlemen have been issued court attendance notices. What I want to highlight is the maximum penalty that the court can impose is $11,000 and or 6 months in jail. We often speak about just the $200 for a mask or $1,000 for a personal infringement notice, but police found this behaviour from these 3 people to be particularly disturbing. Despite the best health advice, they continued on their journey. They left their home in Greater Sydney and put significant risk on the people in regional New South Wales. When I talk to people and look at various posts on social media, there's a strong sense that country people simply will not tolerate this sort of behaviour and they feel it puts them at great risk. I'm sure that as it moves through the system that people truly hope that this sends a really good message in terms of the court outcome to anyone else that wants to participate in this sort of behaviour and put regional New South Wales at risk from the virus. The other thing that I would also like to highlight is the local emergency management committees that are in place in Fairfield, Liverpool and Canterbury Bankstown are up and running today. It has a regional presence across the top of it with Assistant Commissioner Cook. Already today they're looking at how they can make those testing facilities in those areas more efficient, more friendly to the people that use them and the people around them, the residents, the traffic queuing and that sort of thing. It is going to be a difficult time. There's absolutely no question about that, a challenging time for everyone. But the message from New South Wales Police, from Commissioner Fuller, is that people need to be respectful, they need to be patient, they need to work with police in their local areas to make sure that the next 2 weeks is as profitable as possible in terms of getting out of this situation as quickly as we can. Thank you.
Good morning. Can I start by, of course, reiterating, as the Minister for Industry, the comments of the Premier and thank the business and industry groups for the positive response to what was yesterday a very significant announcement that impacts so many businesses, construction, retail, right across the state, and acknowledging the Treasurer and his team, along with many others between the Deputy, my team and the Premier's team, that we've engaged with industry groups to find a way forward. And over the next 2 weeks, we know it's going to be tough, but I do want to thank those industry groups. A significant level of movement from people from Sydney for whatever purpose, but predominantly it's around freight into Orange and Blaney and Parkes and Molong. And what this does is bring a level of risk. So to the communities of regional rural New South Wales, my plea is to stay vigilant, understand that the restrictions we've put in place in the regions are for protecting you, and the further restrictions that we've put in place here in Sydney, especially in those 3 LGAs, is about also protecting regional and rural New South Wales. This is about making sure we're all working together so that we get out of this phase, we get control of the outbreak, and then we can get back to restrictions coming off. But we'll have to do it together. And, you know, my advice to the regions is to keep doing what you're doing. We've been lucky maybe to one point, but the restrictions that have been put in place by the government has really helped secure and keep our region safe. But we will have to put in place further restrictions if there are breaches. And, you know, I just want to talk to the communities of the regions and say, be vigilant, get on top of these issues, wear your mask where appropriate, follow the rules, and make sure it's clear that the message to Sydney is not to come to the regions at this time, because we are about making sure we protect regional rural New South Wales. At this stage, we have a level of freedom in the regions that we don't have in Sydney, and we would like to keep that, but that's going to take an effort for both Metro and an effort from the regions, and that is my message today, to make sure we remain vigilant. Thank you.
Well, thanks, Deputy Premier. Look, I want to begin by acknowledging the stress and challenges and difficulties that many people and families are feeling right across New South Wales today, particularly those in metropolitan Sydney. Our message is today that we will get through this difficult time. We've got through the last 18 months and come back stronger on the other side, and we'll get through the difficulties and challenges that are in front of us today. Like the Deputy Premier and the Premier have said, I particularly want to thank the business leaders and industry groups we've engaged constructively with over the last 24 hours. We want to get through this period of time as quickly as possible, as seamlessly as possible, and the work that industry groups and businesses have had with the government over the last 24 hours, I believe, has really helped in shaping the policy perspectives going forward to keep as many people in jobs and as many businesses going as we can. We know that over the last 18 months we've come out in a very strong way, maintained all the jobs across the state, and that's what we will achieve again during this difficult time. We've always said we're going to put businesses and jobs before the budget. We want to make sure that we keep as many people in work, as many businesses going as possible, and that's exactly what we will do during this period of time. I really want to make it clear today to those who are feeling stressed, for workers right across the state, that if you've had your hours reduced, you can contact Services Australia. Services Australia is there to provide payments to all workers, not just in metropolitan Sydney, but right across the state who have had their hours reduced. In addition to that, businesses, small sole traders, medium and large, can also receive support through Service New South Wales. And there are a range of initiatives available. It's not just one application. There are many grants available to help businesses with cash flow that they need at this time to help with those fixed costs, rent costs, electricity costs and the like. Tomorrow, our first grant applications open, where businesses who have been affected during this lockdown period can apply for up to $15,000. So those applications are available tomorrow through Service New South Wales. They will be processed in around 4 to 5 days. There may need to be some patience tomorrow, because obviously there is a significant demand right now and many people contacting the Service New South Wales Centre. So please be patient, but we've reallocated our resources right across government to make sure we're able to get to your queries and have those applications processed as quickly as possible. There are also another array of other grant programs in terms of payroll tax deferrals, payroll tax waivers for businesses, support for those micro businesses in $1,500 payments per fortnight. But if you contact Service New South Wales, you will be able to obtain what support packages that are available for you. So I just ask all businesses, all workers who feel the stress at the moment, please contact either Service Australia as a worker or Service New South Wales as a small or medium business to access that grant program. I also would like to point out for tenants as well, both retail and commercial, as well as residential tenants who are feeling pressure and have had hours reduced, that you can also get support. You can contact Service New South Wales if you're a retail or commercial tenant. If you're a residential tenant, you can go through fair trading, where you can have rent reductions provided through your landlord. So for landlords, I ask today that you work closely with your tenants. We're all in this together. Please understand the needs and concerns that people have. If we all work together during this time, we'll come out stronger at the other end. Finally, I want to thank the banking sector as well, and Matt Common and the ABA, who have been in touch with the New South Wales Government, who are providing deferrals for repayments, and a whole range of other financial support packages. So if you're also concerned as well about your financial position at this time, please contact your bank. We are all working very closely together to make sure we reduce the pressure, reduce stress, and get out stronger the other side. Thanks.
Can you please explain why workers who live in Fairfield but leave Fairfield to go to work but people who live out of Fairfield and go into Fairfield for work don't?
Because Dr. Chant will be able to provide the medical advice around that, but it's because there is such a high concentration of the virus lurking in the community. We still have unlinked cases, and we know, unfortunately, that local government area still has around 70% of all cases, and therefore that's based on the medical advice. I will ask Dr. Chant to provide the medical advice around that.
Isn't it?
So at the moment, we are really got to balance a couple of factors. Our pathology testing capacity is exceedingly good, and it's improved throughout the pandemic, but it is limited, and we can reach a cap in terms of that capacity. We've been very pushy, although we can do a little bit more, it's really reaching close to that threshold. Therefore, we have to balance who we're testing. And so people going into Fairfield, anyone with the most minimalist symptoms, we want you to be very vigilant, and we expect that given we've been raising in the media and the communications around the risk associated with the Fairfield, that businesses have taken a lot of actions to be incredibly vigilant, to keep their staff safe and put in other mechanisms. So to some extent we're balancing the risks and the surveillance testing capacity. It's been very useful, as I've indicated over the last couple of days, where our surveillance testing has identified a number of near misses for rural regional. We've intercepted people that have got the phone call on the way to leaving Greater Sydney to go into the regions, and hence that's another reason why we've strengthened the order to prevent people going into the regions unless they're critical transport or critical emergency services.
Are those surveillance tests being prioritised over other tests, given that when you get a surveillance test, you don't need to isolate, so these people are in the community compared with people who
our highest, so surveillance testing generally yields a lower probability of positivity. So they're less likely to be positive, so they're not given priority. The priority is given to our close contacts of cases and people that have been at the exposure venues where we know there's been an infectious case. So we do try and work with the private providers to make sure that if you are in a queue, you will be asked if you have been directed there by public health, and we are working with them, with the private providers as well as our own pathology, to ensure that we have faster turnaround times for those cases that are most likely to test positive, and that is that people that have been in exposure venues when there's infectious cases or their close contacts.
What are the turnaround times at the moment? We're seeing high numbers of testing. Is it taking 3 days to get back?
So it varies. We have set up some very, very fast and rapid testing for close contacts, particularly in the southwestern Sydney, with extremely rapid turnaround times. But as I said, we need to preserve that for that very targeted group, because what we want to do is make sure that we can identify cases amongst contacts and then rapidly move to the next level. In terms of the turnaround times, we are seeing some slippage in turnaround times. It's more with some exceeding 24 hours. 24 hours is our benchmark that we'd like to see. But we are working with the pathology providers to work through that. One of the things that private providers has asked us to say is, please don't ring them for the results of the test, because ringing them actually detracts from their work. So just to have some patience. Public health also, to let you know, will hear about any positive test, and so we will reach out with you as soon as we receive that result as well. But please be assured that the private pathology and our public system are working very closely to make sure we manage the increased workload, but we do need to balance these. We can't test, we haven't got infinite numbers of tests and capacity to do that.
Dr. Chan, we're hearing that there's now 250 there's now 250 paramedics across southwest Sydney that are in forced isolation. Can you confirm that number, and what sort of impact is that having on the health response through those areas?
So as a routine, I'm not sure with the exact number associated with it, but I think we'd advise that there were paramedics that had been infectious whilst at work and had come into contact. You can imagine that we take a very cautious approach when it comes to healthcare workers, because healthcare workers are involved in transporting the most vulnerable in the community. And so I'm not surprised that there's a large number, but obviously what we need to say is that action is to keep the community safe.
Positive there. This is one of the replacement staff that were brought in to cover the staff in isolation. Firstly, is there any indication where that nurse has picked up the virus, and have residents there been exposed again?
The latest advice I've got in regards to that case is that that there weren't further exposures to any other parts of the facility because the nurse was brought in for other to support the activities in the sort of lockdown area. So just to reassure you, the advice I have was that it wasn't impacting on new areas of the facility. How the person acquired the infection is actually subject to some ongoing investigations, and some additional testing is being done to also confirm the time of infection. So there were still a few unanswered questions when I was briefed about that last night.
Can I just ask? Yesterday we had a list of people who are allowed to leave Fairfield to go to work. Today we see a list that includes all sorts of different businesses. If you're living in, say, Canterbury Bankstown, and you have a food business that's allowed to be open but it's on the northern beaches, can you leave that area?
Well, what we've managed to do in consultation with the business community, in consultation with people who put food on our tables, who distribute all the services we need, is to have a list of authorised people that are able to leave the area for work. That is now publicly available, and the larger and smaller and medium-sized corporations involved with that task have provided that really constructive feedback. So if anybody is unsure, your employer, your boss will have all the details. But we recognise, and I want to thank the freight and logistics community, because they ensure that all the food and services we need throughout our state is delivered in a timely way. And of course, those type of activities will continue. I don't want anyone rushing to their local supermarket worrying about that issue. Supplies will continue to be provided, even basic things like packaging and things like that. We've considered all those issues, and it's never easy in these situations, but we appreciate everybody for their patience. Please know that list of authorised workers is available, and I just want to stress these following points again. Obviously, people living in the Fairfield local government area have been asked to have a test every 3 days on their way to work or at work if they're leaving the Fairfield local government area for work, for any type of work. But if you're living in Canterbury Bankstown or Liverpool, we're asking you to do that, what we call surveillance testing for work if you're in health or aged care. And we're asking you to choose a day between now and Wednesday to start that, so it's staggered and we don't have the congestion on the roads or also around our clinics. And we're just making sure that we're taking a very precautionary response, making sure that we get those who have symptoms tested in the first instance, as Dr. Chant has said. But again, I just want to thank everybody for their patience. We've worked really hard, and I want to really commend the Treasurer, the Deputy Premier and other ministers who've worked so hard yesterday engaging with all of our stakeholders. Please know that it's our job to keep everybody safe, but it's also our job, and that includes making sure that everybody who needs to get food and services around our state is able to do so.
Can I ask you about the construction industry, please? Thank you, Premier. Can I ask you about the construction industry, and probably the same question for Mr. Perrottet? What exemptions are there for critical work? Is WestConnect still being worked on? And do you think construction workers should be forced to take annual leave right now? It's not exactly fair on them, is it?
The government took the very, very difficult decision yesterday to abandon all what we regard as non-critical construction work. Of course, if you need something in your home to keep your family safe, there is no issue with that. We don't want anyone to feel that they're going to get in trouble for fixing something in their house that's going to keep them and their family safe during these difficult times. But we also have to appreciate, unfortunately, that the sheer mobility of thousands and thousands of people going to multiple sites, small, large or medium, is unfortunately a very big risk at this time. And as you've heard, unfortunately, a lot of those people are in jobs which we all depend on. So as we've heard a number of cases in the regions from people travelling out of the Greater Sydney area who are infectious. We need to stop that transmission of the disease, and we have a blind spot in the data of the last 5 days, and that's always going to be the case. What we see today is what's occurred 5 days ago. We can't have the risk that people are unnecessarily travelling around multiple sites, possibly whilst infectious, and that's the risk we really need to come down on. If we're serious, I'm sorry.
Specifically about exemptions, sorry, I just want to hone in on that topic.
Yeah.
What are the exemptions? What sort of critical work are we talking about? Are we talking WestConnects? And also the question about annual leave for work. Same for Mr. Perrottet, please.
Yeah, sure. The large government projects are not happening because, as painful as it is, we can afford to put a pause on them for 2 weeks, and we wanted to make sure, we are putting the same standards to ourselves as we're expecting from the private sector and the smaller business community. So we're not exempting ourselves at any point, quite the contrary. But we appreciate what this means, and we appreciate the significant burden it has, but we also appreciate the absolute need for what's regarded as critical work. So please know that in terms of making sites safe and secure, in terms of making sure there's adequate security during the duration of the next 2 weeks, to make sure that when construction work does resume, that everything's safe. So that's obviously critical work, and there's a list on Service New South Wales about anyone who's in doubt, who lives in particular in southwestern Sydney, the types of jobs that they're able to do outside of their community. I will also ask the Treasurer if he wants to comment on that.
Mr. Perrottet, you're very pro-business. What do you think about the construction shutdown and the fact that people are forced to take annual leave right now? That's not fair.
Well, a couple of things on that. Obviously, we're working very closely with industry over the last 24 hours. Today, we are standing up a construction industry group to deal with these issues throughout the entire period of the next fortnight, because this is not a precise science, and there will be issues that come up from time to time. Ultimately, there are areas, whether it's in terms of deliveries, critical maintenance, safety and security, environmental issues that will need to be dealt with during this period. We have engaged very closely with the construction sector throughout yesterday, and that will be ongoing every day to make sure that sites are secure. Critical work is able to continue in circumstances where safety and security are not compromised, that deliveries are able to continue. And in relation to the workforce, what I would say to all workers right across the state, regardless what industry that you are in, if you have had your hours reduced, you can go to Services Australia. You can apply for ongoing payments during this period of time. And ultimately we'll continue to work with employers, with the construction industry to get through what will be a challenging 2 weeks. And ultimately as well, we want to be in a position come July 30 that we're able to have construction back up and running. That's not something that's going to happen overnight. We continue to work with that group. We'll be standing it up today to make sure there's that continual dialogue with the business sector.
On annual leave, neither you nor the Premier really addressed that. Do you think it's fair that people right now should be taking annual leave in their homes through no fault of their own?
But also for annual leave, also for parents that may still have a job but have to homeschool.
Yeah, I mean, obviously this is a challenging time. It's not just a challenging time for the construction sector. It's a very difficult time for individuals, for workers, for families right across the state. And what we want to make sure is that we keep as many people in work, as many businesses going during this time. And people are making enormous sacrifices right across our state to keep our community safe. We have always said that this is not just a health crisis, it's an economic crisis too. And we will provide whatever financial support we can to give workers and businesses the support they need to get through this time.
Sorry, sir, that's not the question. The question is, do you believe it's fair that people should be forced to take annual leave right now?
I think what's fair and important is that employers work with their employees to give them the support they need. We've worked very closely, Robert, with the Commonwealth Government to make sure that those workers who have had their hours reduced are able to receive payments through Services Australia. That will provide essential support that workers need during this difficult time.
You said you've been talking to industry groups in the past 24 hours. You made the announcements yesterday shutting down industries. Why didn't you talk to them before that?
Well, obviously, when we go through crisis cabinet decisions and we receive health advice, in a pandemic, decisions sometimes need to be made quickly. And the support and the work that we've conducted over the last 24 hours with industry, I believe will ensure that we get through this period of time as seamlessly as possible. Yes, there are challenges, but there's always going to be challenges in a pandemic, both on the health side and the economic side too.
You can understand how this all leads to more and more confusion. In the past 24 hours, the rules have changed, exemptions have changed. The major announcement was yesterday. People are sitting at home not knowing whether they can go to work or not go to work, whether they're going to get help or not get help. and you only started to talk to businesses in the past 24 hours?
Well, we've had ongoing dialogue with business, but the reality is, in a pandemic, there will naturally be uncertainty from time to time, and the role of government is to ensure as much certainty as possible. And my message today for workers and businesses right across the state for certainty is that if you've had your hours reduced, please go to Service Australia. If you require business support, please go through Service New South Wales. That is the certainty that workers who are concerned, businesses who are worried right now, can get the support they need to get through this time. Eddie, just to finish, Eddie, there are always challenges, as I said, and you can't always be precise and provide certainty every single day during a pandemic. But when that can't occur, what we can do is engage immediately, and I think the discussions that we've had over the last 24 hours and will continue to have every day through the next 2 weeks will provide that certainty and get those businesses, including construction businesses, through this time.
Premier,
in relation to the authorised workers who can leave Fairfield, Canterbury, Bankstown and Liverpool, it's not just essential food and grocery and freight. It's everything from anyone who works at a retail shop that's currently allowed to open, funeral workers, teachers, food and fibre processing and manufacturers, coffin makers. They can all leave the LGA to go to work. Why? I mean, apart from office workers who are supposed to be working from home anyway, who can't leave Fairfield, Canterbury, Bankstown and Liverpool for work? And it's an awful lot longer than just what you said yesterday, isn't it?
Oh, look, we've made sure through consultation with business, community, freight and logistics that we've included the ability for workers to leave that community, providing those things that all of us need. And we've been very open-minded as to the workers that can leave, but we also ask everybody to please put safety first. Can I also thank many businesses who are considering rostering arrangements? We know that a large part of those workforces do come from those 3 local government areas, but businesses have been really constructive and positive in considering rostering arrangements, in considering what they can do to limit movement from people coming from those areas, those communities where the virus is particularly prevalent. And can I please say to everybody, I'm not going to rule out that there won't be further tweaks, because dealing with a pandemic, can I tell you, if you're in our shoes every day, seeing the numbers come in, seeing the spread, seeing the risk areas, there is no exact science, and I've never pretended there is. So I won't rule out tweaks in the next few days to make sure we haven't missed anything. Dr. Chan's advice might become different as well, depending on the scenarios and situations of classes of workers. But please know that what we're doing is providing the certainty that no matter what your circumstances are, as stressful as they are, that nobody will go without in terms of making sure they have what they need to keep going, because we want collectively to be able to bounce back as soon as we can. And we appreciate that there's some functions in society that have to continue, but unfortunately we're also seeing case numbers in those functions, and that's why we're really focusing in on the fact that if you have a symptom, you should just get you tested and go home until you get the health advice.
Premier, you can see that this is really an extensive list, and that maybe that you're going to have to narrow it in the future. Why not just narrow it from the start and be really tight with this from the start?
Well, we need to make sure we rely firstly on the health advice and also on the ability of people to access the food and services they need to keep going, and that's really important. It would be irresponsible of us to exclude people who need to get around their business, make sure that they're providing essential food and services that all of us need. And that's what it takes to be a responsible government during a pandemic. It's obviously focusing on the health and safety of our citizens, but that often involves thinking about making sure there's supply chains, there's food supply, all those things that keep us going. And that's why we are asking workers in particular who are coming from southwestern Sydney. Obviously in Fairfield, everybody is subject to what we call testing every 3 days to make sure we're picking up any cases in people who might not have symptoms. But if you live in Canterbury, Bankstown, or you live in Liverpool council areas, which are very large council areas, in the first instance, we're asking you to have tests every 3 days if you work in healthcare or aged care settings. That could include cleaning those services. It could include being on the site for various reasons. But it's really important for us not to have any transmission anywhere, but most of all in our health and aged care settings. So in the first instance, they're the only category of worker from Canterbury, Bankstown or Liverpool that we're asking to have that, what we call surveillance testing, because as Dr. Chant said, our focus is to really capture people who are presenting with symptoms who have the virus, because they're obvious and they're targeted, and we need to make sure we keep them isolated.
Premier, if this is a list, why didn't you say this list or release this list yesterday? Yesterday you said only emergency services personnel were allowed to leave these LGAs. Some people this morning thought they couldn't go to work, but now they can. It's awfully confusing, isn't it, Premier?
Oh, look, we understand that within the first 24 hours when you announce something, there's always going to be a level of people asking questions, understandably. But can I assure the community that we have that comprehensive information now available on Service New South Wales? And I just want to thank everybody for their patience. Yesterday was a very, very difficult day for everybody. And I'm not embarrassed to say that in public life, yesterday was probably the most difficult day I've had personally, because we don't take these decisions lightly. They're decisions that affect lives and livelihoods. They're decisions that affect millions of people. But my job and the job of our government is to keep people safe, to reduce transmission, to reduce the risk. And I, again, accept it's not an exact science, but please know we rely on the best health advice available. We have the best teams, I believe, in our nation. And can I thank, from the bottom of my heart, those business leaders, construction company members, retail people, tradespeople, everybody who stepped up. This isn't easy for anybody, but we have all come together to do what is in the best interest of all of us, because I don't think there's anybody that wants to see this lockdown prolonged longer than it needs to go. All of us want to get out of this as soon as possible, and that's why, can I say, that we're throwing everything at it, because we've got a 2-week window when we're in a hard lockdown to be able to crush this thing. And again, I ask for patience, because the results won't start coming through, we believe, for at least 4 or 5 days, because of the way the data works. And so I just ask everybody to be vigilant, not to cut corners, and please accept that if we need to tweak information, we will let you know, because as you appreciate, as time goes on and we consult further and people raise issues with us, that we need to respond accordingly.
On that issue, there have been a number of protests now. We're seeing them pop up all over the place. Firstly, what's your message to them? And are you concerned that with the chopping and changing we've seen with the extension to lockdowns, that we are seeing not only fatigue, but people are sort of losing trust now? This is not something we've seen before happen in New South Wales. What's your concern surrounding people losing trust in the message?
Yeah, I think first and foremost, we've been overwhelmed by the vast majority of our citizens who've really stepped up and supported what we're doing, and we appreciate there'll always be people that don't support what we do, and we accept that. But we're asking everybody to put aside your own personal viewpoint and just work for the greater good. And can I say that in most cases the communities have been outstanding, whether it's our health experts or our law and order officials or government officials, whenever we've dealt with communities across the state in very difficult circumstances, whether it's been community leaders, and can I please give a shout out to the hundreds and hundreds of community leaders we've been in direct contact with. Their local advice has been invaluable in getting the message through. Whether it's business, whether it's other non-government organisations, in the main, the feedback has been constructive. Of course people are upset, of course people are frustrated, but the overwhelming feeling has been, how can we help, how can we beat this thing together? And can I just ask everybody to think about that? It's how we can beat this thing together. It's hurting all of us, no matter where we live and what our circumstances. And as we've seen in the last 18 months, different communities have been impacted at different times. And that's just the way this virus works. This strain is different to anything we've seen. And that's why we're throwing everything at it. We have a good window in the next 2 weeks to really crush this thing, and that's what we're aiming to do. And I just ask everybody to think about not just their circumstance, but those of others who are really doing it tough. And again, my overwhelming feeling is one of deep gratitude. I just want to thank everybody for your efforts. There is always people that express their frustration and impatience in different ways. But can I just ask for everybody to please keep doing what you're doing, stay informed. We're here to help you, and as the Treasurer and the Deputy Premier have said, if you need financial assistance, disaster payments are available through Services Australia. That's for individuals, workers who've had hours reduced or can't get to work or don't have money. Please know those payments. We fought hard to make those payments available to everybody across the state. please use that opportunity. And if you're a business that needs those grants or has or requests information, please go through Service New South Wales. We're making sure we've got extra resources to support those organisations to get the message out, to get the help out. And also we've also got family and community services and other areas of government reaching out proactively to those most vulnerable to make sure people have what they need during this difficult time. And we are all in this together. We keep saying that, but it's the truth. And the one consolation we have is when we think about how tough individuals or ourselves might be feeling or what angst we might be feeling, chances are our neighbours, our friends, our family are going through the same thing. And I'm convinced that if we all keep working together, we'll get out of this in a timely way.
It won't be 2 weeks, though. It won't be 2 weeks.
Can I just clarify one thing, just in terms of the 3 LGAs that are further locked down? If your shopping centre is outside the LGA, can you go to that shopping centre?
Well, obviously our recommendation is please go to your nearest and most convenient shopping centre. But if you live across the road from a shopping centre that's in a different LGA, well, obviously, you know, the people understand those circumstances. We ask everybody to apply common sense as well as the strict health orders. Your street might be across the road from a shop. We'd much rather you go across the road than travel 3 suburbs to the next supermarket. So we are applying common sense as well as the health orders, and that's how we've gotten through this in the last 18 months. But please know the health orders are there for a reason, but we appreciate that common sense has to be applied on top of that. And can I please thank the police for the understanding way in which they've approached these issues. Police are here to help us, and they've been helpful in providing information to local organisations and communities. But also know that you're not going to get in trouble if you're trying to do the right thing. You'll only get in trouble if you're doing the wrong thing and you know you're doing the wrong thing. If you don't understand, please make sure you get up to date with the orders. We've provided information in different ways to different communities. But please know that in addition to the health orders, just apply good common sense. Dr. Chant tells us she doesn't want us moving around. She doesn't want us going out of the house unless we absolutely have to. She doesn't want us travelling out of area. So please think about that in addition to what's there in the rules.
Premier, what about bosses? There's been an issue since basically the start of the pandemic, right? For a boss who wants their worker to come into the office because they don't think the worker can work from home. Now, I know that you strengthened the health orders to say you must require the staff work from home unless it's reasonably practicable. So what does reasonably practicable mean in the sense of an employee wanting to work from home, but the boss saying you can't?
Well, obviously, if you're an office worker, you can't be forced to go into the office. And from Wednesday, there'll be stiffer penalties, and that's because that's when the regulations come into place. So please know that if you're an office worker, you should be working from home. Unless there's some exceptional reason why you're not, or you can't conduct your business or your work at home. But nobody should be forced. Nobody should be forced to work in an office environment, and that's made clear in the health orders. And again, it does require cooperation between employers and employees. But we ask employers to really appreciate the spirit of that health order. We don't want people moving outside their homes unless it's absolutely necessary. But there are always, categories of people who, for whatever reason, have to do something important outside of the home. We accept there are those exceptions, but generally speaking, if you're an office worker and can work from home, that's what you should be doing. We don't want anyone outside of the house unless they absolutely have to be, and that's been Dr. Chant's. Again, Dr. Chant will interrupt if I'm saying anything, putting words in her mouth, but we don't want anyone leaving the house. The whole intent of having harsher restrictions is to reduce mobility. If you look at the categories of things that we've put harder restrictions on, it's because we just don't want people to move around. Especially multiple sites, multiple movements means, heaven forbid, if you have the virus and you don't know it, you could unknowingly be spreading it across suburbs and across different groups, and that's the last thing we need. So please appreciate not just the health order, but also common sense approach on top of that. We could try and define every single thing that exists in society, but there'd still be exceptions. And I think the community understands that, and I think employers understand that. But in the main, employers have been very accommodating in terms of rostering, in terms of being fair to their employees. And if that doesn't exist, or doesn't occur, I should say, well, obviously the penalties are there.
Mr. Warboy.
The new vaccine.
I'll get after that. Sorry, yeah.
Thank you. The two vaccine hubs, the one at Lake Macquarie and in the CBD, they're meant to be opening up tomorrow. Are they still on track to open?
Yeah, we're
tomorrow?
on track to open all the hub announcements that we've made are very.
They are opening tomorrow.
Well, they're very much. I'll have to get an update on that, but I've not received advice that anything's been delayed. Quite the contrary.
Okay.
But obviously, would love more doses. So that's the challenge. Yeah. Yeah.
If we're in a position of getting the infections in the community numbers stable,
I'm sorry, I didn't hear the first bit.
if it's going to take 4 to 5 days to start for those numbers on infections in the community to nudge, as you said, it's going to be awfully hard to get that down to zero by the end of next Friday, July 30, when we're supposed to get out of this. That's not looking likely, is it?
Oh, look, I can't comment on that yet, but I will say this. We're looking at all the opportunities we can to ease the burden on the community. So there may be settings we can adjust, notwithstanding where we're up to. Obviously, our aim is to quash the virus. But if there's anything we can do to ease the burden on the community, if we see numbers turning and we think it's safe to resume some level of activity, we'll do that. And that will be based on the health advice. So we've already given a commitment to undertake a level of the construction industry coming back after July 30, and we've undertaken to do that. But we're constantly reviewing the settings. The health team are constantly giving us advice. And if there's any opportunity for us to ease the burden on our citizens, of course we will do that. But please know that you will know as soon as I know. We make an effort in New South Wales to make sure that as soon as we receive health advice, we respond to it and we make that information available to the community as soon as we can. And that's why yesterday, when we had made those decisions to make those difficult announcements yesterday, we were keen to get that message out to the community. And obviously we spent yesterday talking to stakeholders and business leaders to make sure we didn't leave anything out. And again, we welcome that ongoing feedback and just thank everybody for their efforts.
Mr. Warboys, and I'm going to get out a cheeky 2-for-1 here because it's a tough crowd. In terms of compliance, you're going to get more resources into communities, so you're going to expect more confrontations by nature of the fact there are more of you forcing that compliance. Have you noticed anecdotally more of a pushback? And the other question is, you're from regional New South Wales. How do you personally feel, and the same question for Mr. Barilaro, the 3 men who tested positive for COVID, had COVID, knowingly went to work in regional New South Wales? That is staggering.
There's no doubt, and I completely understand people from the Central West and indeed regional New South Wales that are absolutely angry with that behaviour from those 3 gentlemen. Despite what I would say was the very best and strong health advice, they left Greater Sydney and then at one point on their journey they were again provided some very strong and advice from health, and they continued on. It is such that we need to make sure that we send a very clear message, and that is that $11,000 and or 6 months in jail is now a penalty that is upon these 3 men. Those men will attend court, and of course what will happen at court will be up to the justice system. But I know that the people right across country New South Wales are also digging in hard in the next 2 weeks. And when people do what these 3 men did, it makes it really, really difficult for people in country New South Wales to continue to put the efforts in that they do. So that people are angry about it, there's no doubt. The behaviour is reckless and it is certainly very selfish.
And the same for Mr. Barilaro, sorry. People knowingly having COVID and still driving into country New South Wales.
There's no question what these 3 men did was deliberate and reckless, knowing on advice that they should not have been travelling to the regions, and it's not acceptable. And that's where we've just heard from the Deputy Commissioner that the full arm of the law will come down hard. The justice system will come down hard. We've got significant penalties in place for deliberate, reckless actions like these. And this could actually put in jeopardy not just a community like Orange, but the Central West, and put it at risk regional rural New South Wales, where the health system would be completely swamped if we had an outbreak that was similar to Sydney. That is why the restrictions we've got in Sydney are significant to minimise travel to the regions, to minimise travel across the city, and we'll make sure we enforce it. But this is reckless, careless and deliberate, and they'll feel the full brunt of the law.
Thanks, everybody.